Hello, my name's Amanda Schrader, and I am a nursing student at Indiana State University, and this is a presentation on oral hygiene in children. Learning objectives. By the end of this presentation, you should be able to recognize the anatomy of a tooth, understand factors that lead to tooth decay, appreciate the importance of fluoride use and how it can help prevent tooth decay, recognize the etiology of cavities, understand important steps that can help prevent cavities, identify the problems that can develop with poor oral hygiene, recognize the symptoms of tooth decay, understand the process of demineralization and remineralization, and recognize common sources of fluoride. Introduction to oral hygiene. Cavities are also known as caries or tooth decay and are affected by such factors as bacteria, saliva, sugar intake, and fluoride. Cavities are one of the most common chronic conditions in children in the U.S. and is 5 times more common than asthma. 1 in 5 children between the ages of 5 and 11 have at least one decayed tooth. Caries or cavities are preventable, completely preventable. Children from low-income families are twice as likely to have caries compared to those from higher-income homes. All about teeth. Here is a picture of the layers of a tooth. The outermost layer is called the enamel, and it is the hardest layer. The inner layer is called dentin, and it is the largest part of the dental tissue. In the middle there is the pulp, and it is the soft tissue that contains the blood supply and the nerves. And the root is the bottom portion of the tooth that secures the tooth in place. Primary teeth, also known as baby teeth, typically erupt or emerge from the gums around 6 to 12 months of age. There are 20 primary teeth. The first tooth is usually lost around age 6, and the last primary tooth is usually lost around age 12. There are 32 permanent adult teeth. Etiology of cavities. The two terms used in this presentation are demineralization, which equals disease, and remineralization, which is the health of the teeth. When bacteria are on the teeth and are then exposed to sugar, the bacteria ferments, which produces acid on the enamel of the tooth. The acid decreases the pH of the dental plaque, making it more susceptible to caries. Increased bacteria leads to increased acid, which leads to decreased pH of the surface of the tooth, which leads to demineralization of the tooth enamel. Saliva replenishes these minerals, such as calcium and phosphate, and aids in remineralizing the tooth. Signs of tooth decay. Tooth decay includes bleeding or swollen gums, bad breath, brown or black spots on the teeth, and if infection is present, the child may have a fever and become extremely irritable. Consequences of poor dental health. This includes a lack of self-esteem for the child, possible communication problems with their speech due to dental pain. Dental pain can lead to lost sleep, poor growth due to decreased nutrition due to tooth pain, poor learning, or even behavior problems. All about fluoride. Fluoride can prevent 33% of caries in baby teeth. Fluoride does this by inhibiting demineralization. It also inhibits bacteria, and it promotes remineralization of the enamel of the tooth. Children with fluoridated tap water have less cavities than those with no fluoride in their water. Brushing daily with fluoride toothpaste has been shown to decrease caries significantly. Fluoride can be supplied in water, toothpaste, or mouth rinses. Another protective method that can be used is the use of sealants on the back molars. This can help prevent up to 80% of cavities. Prevention. Prevention is key when dealing with poor dental health. There's numerous things that caregivers can do at home to help prevent caries in children. Parents should help children brush teeth twice a day with fluoride toothpaste. Children should drink water that contains fluoride. If the dentist recommends it, a sealant can be placed on the back molars to help prevent caries from forming. Children should decrease their sugar intake, especially in forms that will remain on the teeth for prolonged periods of time, such as really chewy, sticky candies, or having babies sleep or nap with bottles or sippy cups. Parents need to assist and/or supervise with brushing twice a day. Caregivers should also schedule their child's first dental appointment around their first birthday and continue with routine dental visits after that first screening. In conclusion, poor oral hygiene is one of the most common chronic conditions and is preventable. Factors that influence susceptibility to caries include bacteria, saliva, sugar intake, and fluoride use. Demineralization leads to disease. Remineralization leads to improved dental health. Saliva replenishes minerals, aiding in remineralization. Fluoride inhibits bacteria and enhances remineralization. Children consuming fluoridated water have less cavities than those who don't. Prevention is key. Here's a list of the references that were used to make this presentation. I hope you enjoyed and learned something. You can now click the link below to take the post test to see what you learned. Thank you.